Welcome to the slop farm. Enjoy the video.
You begin by collecting a high-concentration sample, preferably first morning urine, because higher HCG improves sensitivity. Once you have 0.51 ml, check the test expiry and storage conditions to avoid false results. Make sure you have a timer and a clean, flat surface. Open the foil pouch only when you are ready to start, and label the sample with date and time so you can track timing accurately. You now apply urine exactly as the instructions state. Either add drops to the sample well or dip the strip for the specified seconds, because inconsistent volume causes errors. Once done, start the timer and leave the device undisturbed. Movement or tilting can break flow and invalidate the control. Make sure the control line appears first. Then use the designated reading window, since early or late reads can give misleading faint lines, or if you finish by reading and recording results within the specified window, take a photo and note time and line intensity for comparison. Then dispose of the used test as biohazard waste and clean the area. Wash your hands thoroughly. If the result is faint, or the control line fails to appear, repeat testing in 48 to 72 hours or get a quantitative lab test, because rising HCG confirms pregnancy and rules out.
Thanks for watching. Consider subscribing if we helped you today.